Hello everyone, Dr. Jim Hoven here, welcoming you back to another episode of Ramos Law's Difference Makers podcast, where I have the chance to connect with people that are in our circle or people that we meet who are making a difference in the lives of others, whether that be at a local level or beyond. And today is one of my very, very favoriteest, most wonderfulest people in the entire world, Miss Jessica Lara. She's here to join me because we're going to talk about health today. We're going to talk about specifically how hormones work with someone's body to help them experience a level of health that they might not have had for a long time. Right, Jessica?
That's right. Thank you for having me. I'm
Absolutely
excited to talk about this.
Yeah, I know. Well, we've been talking about doing this for a long time. And in full transparency, Jessica and I do work together at FitMD. So Dr. Ramos has the FitMD clinic, and Jessica is our amazing PA over there, does so much of the clinical care and taking care of stuff. And Jessica, you've educated me so much on this medicine, and I'm such a believer, and to be part of that business with you and talking about these kinds of issues, to me, it's absolutely critical. And right now is as good a time as I think there could ever be to talk about this, because there's been so much stress and angst and all this in the world. And of course, if people are overeating, they're unhealthy. If they're overstressed, they're unhealthy. If they're not sleeping well, they're unhealthy. And what we are talking about today with hormone replacement therapy and wherever else this conversation goes, that has a big impact on what we can do to stem the tide, right?
It's huge. With everything that's been going on, like you said, all like the stress, the activity level, the diet, everything has changed for a lot of people. And so I think what we do is just a really great support. Like, everyone wants to do what's best for themselves, and we also want to get the most out of that. And I think that's a big piece of what we're doing.
Absolutely. And when people talk about or hear the word hormone or the phrase hormone replacement therapy, I think there's probably a couple connotations that they can take. There's one of a kind of a synthetic hormone that is, every hormone is kind of made up, but there's some is more biologically normal, if you will, than others, right? Basically all hormones are not the same.
That's right. I think probably the most common thought process when we talk about hormones, it may be in terms of athletic performance or like bodybuilding type of things. We get everybody coming in as like, I'm not trying to do this, and some people are trying to do that. But that's, I think, steroids and misuse of anabolic steroids and things. That's one thing that people think about when we talk about hormones. And then the other might be kind of more along the lines of what we are doing, which is, bioidentical or hormones that are naturally in the body and that we need. But there's just a lot of controversy that's been around them in the past, and that has affected the way people think about it and the stereotypes associated with it and what it means. And there's just a lot to it. So it's usually those two different pathways. Are we talking about bodybuilding, athletics, or are we talking about these hormones that cause cancer and these scary things that I've heard?
Yeah, and we're definitely going to dive into those today. I think both those are really critical pathways to discuss. But before we do, I'd love for you to share your story about why you, as a trained PA in all kinds of areas, like you have a wide skill set as far as your medical knowledge and how the body works. How did you get introduced or fall in love with this discipline of hormone replacement therapy?
Such a good question. I feel like with a lot of things are sometimes meant to be, basically because when I came out of PA school here in Denver, I went to CU, and I immediately began working in family medicine and kind of general practice throughout the age span. And then I also worked in a position specifically to help people with weight management, and I had to begin learning about the hormone management side of things. It's really not something you find within conventional medicine. So none of the rotations and the training really prepared me for that approach, that sort of proactive hormone optimization aspect of that position. And so right outside of school, I began my journey into looking at medicine a little differently. So staying conventional and, kind of mainstream, but also starting to think differently right away. Like, are we approaching health in the best way, or is there more we can be doing? And so again, I started these two different positions and began learning right away that kind of the hormone optimization stuff. You have to go to separate trainings and find conferences and find people who specialize in that. And so that's what I started doing right away. I just thought, how can I help more?
Yeah, you dug in. And so going from a weight management, you span kind of the continuum of people with diabetes and, sickness, colds and flu, family care. And then you start moving, you start seeing your pathway becoming clearer with health. So whether it's through weight management or hormone balancing, when you started seeing the power of the hormones in the body, not that you and I, in my training as a chiropractor, I studied that physiology, and I'm sure you did the same, but when you started seeing it at the micro level of the individual walking in front of you, did it just open your eyes, like a curtain was lifted or something, when you just saw those first handful of patients that really drove you? Or what was the inspiration to now dive all in?
Well, I kind of always refer to this situation where a woman came into the family practice and had mentioned just offhand in her annual physical that she was on bioidentical hormones. And I just remember, I don't know why, but I just remember kind of dismissing it, not as it was unimportant. I just was like, I don't even know necessarily what that means. And we're doing all these other things today. And I kind of just set it aside. And then it actually was a big part of what I began doing. And so that really drove me to, number one, because I don't like not knowing things. I was like, what on earth? But more importantly, I just saw patients, and I was just thinking, like, we're helping and we're doing these things, but is there a way we can not prevent them coming in, but just get ahead of these things that we see every day and have to deal with and be a little more proactive? So that just really inspired me. And again, it's a different way of thinking. I started recently reading more about just medicine as like in a historical perspective, which surprised me that I had not really thought about it like that before. I really grew up in a medical family, and so I was just in it. And then I realized there's all these great books that explain like how we came to be where we are. And I find that really interesting in terms of medicine. It really helps me understand why we are where we are and how we can go maybe a different direction with it. So that just inspires me. It's just a different way of thinking. And so I guess it was a gradual onset of like, I had not thought about it in the right perspective before.
That totally makes sense. Yes. And then once you start reframing, like all of us, your worldview changes, your paradigm changes as your experience changes. Mm-hmm. So you start learning about hormones, and now you become qualified through all this extra training that you do. You know it. And I mean, you and I have had enough conversation on this. You are an expert. There's no doubt about it. Our patients know it. You know it. Our team knows it. I know it. So what is it about testosterone specific, since that's one of the main fundamental molecules that we use, that changes people's lives, both men and women, because we treat men and women? What is it about testosterone that affects the body so much, or how does the body need testosterone? Maybe is a better way to ask that for men and women.
So I guess you have to start by thinking of hormones as what they are, which is messengers. So they are carrying messages throughout our body. I always call the brain our thermostat, just because it makes so much sense. It's really up there kind of monitoring and controlling everything that we're doing. That's where everything is kind of organized. And so we send out these messengers, and it's hard not to get, my major was cell and molecular biology. So I always like zoom down into the cell level. But without going too much into that, these messengers are sort of just like managers around the body. The different tissues and the different cells within those tissues, they all need different signaling. And so testosterone is one of those messengers that's going to each of our tissues and telling it to do its job.
And we need a certain amount of it, right? Like you have to have a base level of testosterone. And
at different times in our lives.
Yeah.
So, it's so interesting if you learn embryology, the way the fetus develops, and when we start getting this hormone signaling, it's fascinating. So it just makes sense that we need those things. And again, when you think of the way we're thinking about things, which is like, oh, eventually, you stop producing these messengers. Like, do we want that? It doesn't sound like a good plan to just kind of let them drift off into nothingness. Maybe we don't need as much as, a young kid or whatever the case may be. Does a female need as much as a, pubertal male? Probably not. But I don't think just letting things dwindle off into the sunset helps people to feel well throughout their entire life.
So let me ask you this from maybe a theoretical perspective or maybe not. Because of our lifestyles, because of the way that we eat naturally, the standard American diet anyway, also known as SAD, right? Standard American diet, and the high stress levels, the lack of rest, the lack of exercise, does all that accelerate a decrease in the production of the messengers along with time? Or is the time bandit alone the stealer of the messenger, in this case, what we're talking about now, testosterone?
Like most things, there really is a balance, and for sure our genetics and time and all of that has a key role. But then we know, I mean, there's so much in our environment, and that's kind of the next sort of big new wave of what people are looking into, are things in the environment that are acting like hormones and what that's doing to our bodies and how it's disrupting our production or our signaling.
Can you give some of those things? Give some examples of what, like, is it the lights in rooms or screens, or what are some of those things that could disrupt our natural hormone production?
Mm-hmm. Many things, too many. It's sad to think about, but many things. So plastics, things that items are contained in, that we're touching or that we're ingesting in some way. In the foods, our preservatives, radiation in our environments. We have so much, technology is booming, obviously, and there's just things everywhere. Yeah, I mean, people worry about cell phone towers, all kinds of things. So to me, that's very overwhelming to think about. So I can imagine for a lot of people it is. But as we kind of delve into that and sort things out one by one, I think we'll find, things that are causing problems and maybe ways to address that. But I really don't think that hormone supplementation will probably ever be not needed. Well, I guess
that's so funny that you say that. That's literally where I was kind of thinking and going with the question, Jess, is as a chiropractor, my thing is, should everybody have to get adjusted? No, but based on all those same lifestyle factors that we just talked about, what I found, and even as I continue to look at spines today, most people can't overcome the stresses, what some might call the load or allostasis or whatever term you want to put to it. They can't overcome the inertia of the lifestyle that they're within. And so they need some sort of, the word you mentioned was supplementation in the chiropractic world. It would be some sort of outside injection of motion or stretching or flexibility or something in order to offset the stresses coming in. So what I think I hear you say is that in the hormone replacement world, that because of all these external factors and father time, the biological factors, that there's a place for everyone to consider if they're not performing right, if their blood work doesn't work right, if they're outside of the normal zone, they should be evaluated for testosterone or some sort of hormonal replacement therapy. Is that accurate?
Absolutely. And I'm glad you hit on that, because in an ideal world, I get this question a lot from patients, like even when we do see their labs and they're like, what could I do? How can I naturally, whatever, am I stuck with this forever? What can I do to optimize this on my own? And in an ideal world, we could do that for everyone, and there'd be all these fixes. And sure enough, you can find them on social media and online. You can find resources, but especially with, sorry, I'm going to get off track, but with weight loss, this is a big issue. It's like, well, you should just be doing these things. You should just be eating a clean diet and exercising every day and not doing this and not doing this. Well, we should, but let's also be a little bit practical. So not to be like a downer or negative, and I'm certainly not. I'm very optimistic, but I also recognize, like, in reality, nobody's perfect with those things. And even people, right, when people are doing a really great job, they're still fighting against like genetics and things like that. So it's just not reasonable to think, or basic, I'm losing the word, require, I guess expect, that's what it is. Expect of everyone that we're just going to implement all these perfect things and pretend like there's still not things outside of our control that are even causing problems.
Right.
So there's a balance.
So so that people who have never been exposed to this material before, in our audience so that they might have a better understanding. If someone is deficient, let's just talk about the major hormones that we deal with at FitMD.
And testosterone, you're right, is probably the biggest one. Mm-hmm.
What would a man or woman expect to feel if their numbers, their testosterone levels, those numbers start dropping?
Mm-hmm. So there is a wide range of kind of spectrum of how people come in and present, but there's a pretty typical list of things that people are noticing. So low energy is number one. They're just kind of fatigued. They don't feel like they are where they used to be. Now, we like to justify all of these before I go on. We like to say, oh, I am getting older, or I work a lot, and on and on. Okay, but you're really tired and it affects your day and you're not performing optimally. So that's a big one. Energy levels, moods. I find in male patients, it's more often almost like an irritability or kind of edgy, just kind of
agitation.
Yeah, agitated a little bit. And women, sometimes it's a lower mood, more depressed moods, but some sort of a mood impact often. Low libido is a huge one for men and women. I think for women, it's been really, really overlooked, but in men, it's a very sensitive topic. So I think for both, it's a pretty big issue. Libido is sex drive or interest versus sexual performance, where men are maybe struggling to perform, and those are sort of two different processes. So I usually separate that out. Not everyone has both. Like someone may have a low drive, but when they perform, it's fine. And same thing in women. So what else? Body composition is a huge one. So I'm starting to put on fat more around my midsection. I'm doing all these things in the gym and eating, but I still can't get rid, like right around the belly, of this extra little fat I've got going on, or I find it really hard to build and maintain muscle mass. Not a vanity thing. So muscle is basically an endocrine organ. It's a hormone sensitive tissue in our bodies, and it's really, really important that we prevent people from becoming frail later in life. Bone density going down, they're having fractures and dying from those things. It's not unimportant to have good muscle mass and an optimal body composition, and those are some of the bigger ones.
And what about for women with estrogen? Does estrogen get out of whack for women like testosterone does for men and women?
Yes. So in men, the way we kind of describe it is for men, we're finding it's a more gradual process. So even starting late 20s, early 30s, which sounds really early, but that's just what we're finding. People would probably be shocked to see the age of men who come in with really low levels. So for men, it's this gradual process through time. For women, there's typically this period of time, can even be like 10 to 15 years prior to like I'm done having menstrual cycles every month. And we call that the perimenopausal transition. So there, testosterone is often low right away. So, I mean, you're 10, 15 years out from menopause, you're really not thinking about that situation for yourself, and already you're deficient in testosterone, which I think is a big cause of that, women in their 40s being like, oh, what's going on with my body? Like suddenly what used to work doesn't work. But estrogen comes last is where I'm getting at. Progesterone is another important sex hormone in women that actually usually starts to decline earlier in time. So estrogen kind of hangs around. It's like almost the last to totally go, but there's usually this transition period where we're deficient in all three of those things in women.
And so I would imagine then with women, it's important to get the message out like, hey, don't wait till you fall off the cliff with the last soldier standing. Estrogen ends up dying off or running away. You fall off this cliff. So helping them know should women look for signs of how they feel at a certain point, or is it just part of a routine blood work that women and or men should be looking to step in here at the appropriate time? Because I'll tell you a little bit about, my story because you've been part of it, but for those listening, I'm definitely on the program, and I have been for going on 3 years. And the way that I would describe my journey is if I were to put people into a couple of categories that I've seen now that have come through our clinic, is that we have people that feel like crap. I mean, like you said, can't sleep, putting on weight, low libido, just no energy, right? I wasn't that guy. I felt really good, but I noticed that my workouts, I was working out either just a little bit less hard, but pretty much the same, but I wasn't holding quite the same muscle mass. But I was having difficulty sleeping, but still performing at a high level, like everything was good. And then after seeing the results of my labs, I said, well, let me just try this to see what it does. And so I wasn't the guy that felt like crap. I was the guy that was pretty good. And as I realized, I still had a lot of ceiling potential left. And so once I got on it, I noticed that I could sleep better, but not need as much sleep and still function really good. I got way better results per hour in the gym or my training, leaner with better quality muscle mass than I had before. And my focus was really good. Again, even if my sleep got goofed up for whatever reason, and I've found that for me, it's been an ongoing thing since I've been on the program 3 years, I found it to be that story. So I think from what we're seeing, I don't know if you agree with that, but those are the two typical categories I've seen. People feel like crap, or people want to stay kind of on the edge. Is that accurate from what you see, or is there any other group that we really, really focus on?
I would say that's pretty accurate. I really like the ceiling, the way you put that. A lot of times I explain to people, it's not like we're looking for problems, but you don't know what you don't know. And so I think it's natural for people to hope that they feel okay, they're functioning kind of like you are, and you hope that that's the way you're going to be in 10 years and in 20 years and in 30 years. But I think if you look around, you realize that like those type of people are the ones that you're accumulating these effects, and likely they're there, you just don't recognize them, they're fairly mild, then at some point they will be catching up with you. So that's, I think, what's typically going on there. It's natural to hope, like, I feel pretty good, I think I'll keep feeling good, maybe I'll just feel, but we looked at levels, we look at blood levels, and we can see they're not optimal, they're not where they used to be. What are the effects of that for 10, 20 years? And then where do you end up down the road? So I do think people wait. They're starting not to, because it's becoming more available. I think people are waiting a while and they're really hoping. And I explain to people, hey, you always have the choice. Like, my philosophy as a provider is to empower people. I want them to have the information, and I want them to be in charge of their decisions and what they end up doing. So you don't have to do anything. I may recommend hormones for you, and you can decline, but I want you to have that information. And then also now you have labs you can refer to down the road. You can be like, I am still kind of tired and I don't sleep very good, and let's do some labs again. And then we see, like, it's still not great, and maybe we should go that route. But at the end of the day, you don't have to. I think the information is important regardless. So I think what you're getting at is people do sit in that place where they're like, I'm working, I'm not miserable, I feel okay, I just feel like I'm getting older. Well, you may be the perfect person to really take care of things in advance and prevent this accumulation over time that's really going to catch up with you, and you're not going to feel so great down the road.
I agree. And I think you said something that sparked a thought in my mind about blood work. For us, we do a mixture of a few things. Like our approach when it comes to hormones, from what you've shared with me, is 4-pronged, basically, right? We got the consultation, like, what's going on? And then you're telling us your symptoms and your problems and that kind of thing. And then once we know what those are, now we want to know your goals. And so once we find the issues, now what are the goals for that individual person? Because you said at the very beginning of the show, do people want to go down the athletic side and they want to be super strong and powerful and this and that? Or do they just want to function better and what we call live optimized, right? That's our deal, is helping people live optimized. Is it somewhere in the middle? But when we know those two things, then we put together the technologies. That's when we bring in the in-body for the biometrics, and we bring in the lab work with an exam. You put that soup group together, now you come up with this plan, and the plan can vary from person to person. So I'm interested, as you're creating the plan on the blood work side, I've heard commercials, and I've not been in any of these places, but it's like, hey, come in and, do a blood work panel for $90 or whatever. And if you do this, then it's free and blah, blah, blah. So not all blood work is created equal as far as telling the story on what kind of what kind of plan you really need and what the big picture is. Can you explain what, if someone's looking for this, what kind of blood panel should they be looking for? Not piece by piece, but kind of broad spectrum things that people should look for so that they don't just get their testosterone level, because that is not near enough.
Right. So in our panel, I basically describe it as we've got sort of two, I guess you could say pillars, but our labs consist of two things. One is a panel of kind of screening tests to give me an idea of whether there's something other than hormones that may be going on and causing these symptoms. The symptoms that we're discussing are very sort of non-specific. They could be related to a lot of things, which is why we go into the background and the medical history. It's really important to do that and not just be like, oh, I'm tired, it must be low T.
Yeah, everybody gets a testosterone shot.
That would, I'm sure that happens, but we like to make sure this person, their white blood cell count is normal and there's not some kind of brewing infection going on, and that they're not iron deficient and anemic, and that's why they're tired and they just needed to take some iron and they're good to go. So you can see sort of suggestion of potential nutrient deficiencies and things in a blood count. Make sure their liver and their kidneys are generally functioning well. So kind of like screening tests. And then, so just if you bring me a total testosterone level, I'm still going to look at those other things. So that's just not adequate. We want to check the prostate marker in a male, just to make sure that nothing's going on there that may be potentially related to the genital urinary tract, and that's why there's sexual dysfunction going on. So we don't just want to like zero in on hormones. And then on the hormonal side, so reference ranges are very broad. Every lab is a little bit different, and there's not controversy, but there's just different approaches. Some people are all about the labs. Some people are all like, they don't think labs are useful at all. They don't even barely do any. I think we emphasize labs probably a little more than just middle of the road. I think they help us, especially over the past few years. We've become very precise with dosing and getting people dialed in using lab tests. And so making sure you're getting the active hormone levels, not just a total testosterone, but the free level. How much of the total that you have is actually usable to you?
Yeah, I want to stop right there because that's so important. It's people. So if people have never heard this concept before, think about this. Think about it this way. You have a bunch of testosterone floating around in your system, right? That's your testosterone level. And when you explained this to me, it made so much sense. But not all of it's usable. So it's all floating around, and there's this protein that's out there that can bind up your testosterone. And if there's a bunch of that in there and it binds up a bunch of testosterone, it leaves less what's called free testosterone to do the job of testosterone, right? Mm-hmm. And so then what we need to know is what those numbers are. So if all you're looking at is total, you could have a bunch of overall testosterone and hardly any usable, and then you still feel like crap even though you have a lot of testosterone in there, which was my deal. I needed to make sure that while my overall number was good, my available number was not good. And so we had to do a very specific program with me to make sure that I had usable testosterone. That's what made all the difference in the world, combined then with the other things that we did in my case. So I just wanted people to know that that's a really big deal, not just their total number, but how that kind of breaks out, if you will.
Mm-hmm. It just allows you to be a lot more specific and target how a person actually feels and functions a lot better. Like it just makes more sense. Sometimes, and I think that's why previously just a total level was fine, sometimes the binding globulin's pretty middle of the road, and so the total is going to look pretty much like the free. That's just not always the case. It's just not. So, definitely want a free testosterone level. And the sex hormone binding globulin, that's the protein that you're referring to. Everybody makes a different amount of that. It's not really something you have control over, aside from if you're malnourished and don't have the building blocks you need to make proteins in your body. But other than that, it's just an individual kind of variation that we know about, and we try to account for that. So
that's so good. And again, being able to know that not all doses are created equal because not all people are created equal. That's where you get into the specificity of the medicine and the individual patient by patient kind of case diagnosing and treatment plans, right? It's so important. But I know that from our perspective, we don't just want exogenous or outside testosterone coming in, even though it's bioidentical. we also want the body to create its own testosterone best it can. So that's why in my program, I do another medicine in between my testosterone days. And so then I do either gonadorelin or HCG, and that helps my body create its own testosterone, right? So that I don't become dependent or something. Is that an accurate way to describe it?
Yeah. So again, with a thermostat reference, when the brain sees, this is something I explain every day. So I love putting it on here because I just explain it all the time. The brain sees hormone levels. It doesn't really care where they came from. It's just assessing what's the level. So when your testosterone levels are awesome, it doesn't need to signal the tissues that normally make testosterone for you, which in males is your testes. So it's not sending out FSH and LH like it was, because it's like, we're doing awesome.
We're good.
We're producing. We're good. So we want to keep those cells, your testicular cells, awake and functioning. We don't want them to sort of go dormant or go to sleep. You can use those medications to sort of bring levels up, but we don't really want to stimulate so much that we're getting optimal levels. In fact, I don't really believe that you could. It's a nice idea, but it doesn't seem to work as well. But really the idea is we're going to put these great levels in. We want to keep them there, but we also want to keep you doing what you were doing before. Maybe you're only producing 400. That probably means nothing to everyone, but lower end of normal testosterone. Well, let's at least keep that going for you. You're not going to see the two different sources on your blood work. That's another question. Like, well, how much am I making? Can't see that, but there are ways to know that we're doing a good job of supporting your natural production.
I love that. And women don't need as much of that because obviously they don't have as much testosterone need or levels in the first place, right? So we're predominantly talking about men with the self-support stuff. I'm interested on that universal hormone that is so important to all of us, thyroid. I know that's been something that you've put a bunch of time in, and we have a lot of patients that are doing thyroid. Tell us a little bit about how the thyroid works, kind of the overall things that it does, and then why people might need thyroid hormone.
So the thyroid gland, super, super important. I'm glad you brought it up because this is another one that I think people are learning more about, and they're advocating for themselves and sort of changing the way we operate. But thyroid gland sits in the front of the neck, and it runs, essentially the hormones it produces run our metabolism. Again, almost like that manager sort of analogy, going around to the tissues of our body and telling them to do their jobs. Wake up, do your work. Kind of like when bosses in town, people function kind of at a higher level usually when they're being monitored. So that's sort of how I describe thyroid hormone. It's not going and sort of doing its job. It's keeping everyone else high functioning. As you get those cells awake and alert and functioning, they are using energy. And so we sort of think of thyroid as your metabolism. The more thyroid hormone you have, the more energy you're utilizing. So thyroid has far-reaching effects because of that. We need it, from when we're in our mother's womb. You need thyroid hormone to develop normally, and then ongoing to function at a normal level. So conventionally, we would check this test called a TSH, and that's actually not even a thyroid hormone. That's the test that tells us what the brain thinks of our thyroid hormone levels. Thyroid stimulating hormone is what it stands for. And so the brain's sampling our hormone levels, which are T3 and T4, and it sends out TSH to the actual gland if it's like, hey, there's not enough. Wake up. I need some more of that good stuff. So that's the conventional test that most people get. Again, with the lab testing, if you go get blood work in regular medicine, quote unquote, kind of conventional, we're going to check a TSH usually. That's about it. And if it's normal, then it's assumed that your thyroid hormone levels are normal. But we find that a lot of times that's normal and people are sitting way on the low end. And they feel that too. They're symptomatic of it. It's not just someone who feels great and they're just kicking butt in their life and they happen to have low hormone. They're usually tired, cold when they shouldn't be, constipated. Their moods might be low, again, with the training or the dieting and exercising, and they're just not getting the results they should be, kind of brain foggy, and just not clear and sharp and on point. So that person probably, they're technically normal, but they'd feel a lot better if we just brought them up to the top end of normal. We don't, take people outside of the range like, oh, let's try to get like a bunch of weight loss.
Let's
Thyroid's
double it
a
up.
weight loss drug. No, not like that. You will get some effects because of the processes I just mentioned. As you're telling your body to utilize energy, that's kind of calorie burning in a way, but it's not a weight loss medication. It's just another piece. It's an important hormone signaler that you need in there, and you need it optimal. And all of these hormones talk to each other. So again, optimizing just one, I guess that's good, but really you want to get the whole team on the same page.
Yeah, the symphony. You want all the instruments
Yes.
working so the music plays right.
Right.
Well, what about this, Jess? Is there a time where, because from the anabolic side, you mentioned athletes and how they're using anabolic steroids in a performance enhancing way. In that world, I used to be pretty up on that information when I was practicing and treating a lot of athletes. So I don't think this has changed a lot, but at that time you wanted to cycle your steroids on and off so that you gave your body a chance to rest. As far as what we do, it's a long-term approach, because you're, like you said, the brain's just paying attention. Do I have the needs met that I have? If someone were to ask, okay, I get it. I need to get my hormones checked, whether it's testosterone, progesterone, estrogen, thyroid, whatever it is. But can I be on these forever? And how do I know if that level's the right amount for me for 1 or 2 or 5 years from now? First of all, is it safe to do that? And second, how do you monitor where you should be?
So great question. It's one of the most common ones I get. I would say I think it's natural for people to wonder, like, do I have to do this every day? Most providers like myself in this realm liken it to like showering, taking your vitamins. So like if you want the optimal levels, you have to continue supplementing them and doing your foundational stuff, of course.
And it's safe to do that. You're saying, because some people, like you mentioned, there's some controversy about, can this stuff cause heart disease or cancer and all that kind of stuff? And anything done incorrectly, whether that's eating cheeseburgers or taking vitamin D or doing hormones, anything done incorrectly can cause a problem. But Are you saying that you can do this when you say supplement it, like showering and all the rest, you can do it long term as long as you do it smartly? Is that fair assessment?
I think that's fair. You might find that people say technically they'll say there's no long-term studies on this, and we've been doing this probably, I think, at least 50 years now. But in terms of like scientific studies, some people feel like there's not enough evidence in terms of like long-term use. Most of us sort of disagree with that, especially in terms of doing it appropriately. So that means you're not supplementing outside of an acceptable range. So you're staying physiologic. Like if you didn't know someone was on that testosterone supplement and you check their labs, you still wouldn't know because they're sort of in range. And you're monitoring other things, so you're not seeing any effects on like their blood counts and things like that. So when done appropriately, it's safe to do that way. The cycling thing, so that comes from, people, they're using a lot more than just testosterone, first of all, but they'll use that because, like we're all saying, it does these really great things for the body. But they'll also use other substances, and they'll use much higher dosing typically. So they're kind of in their own league there, but that is
dangerous, by the way. That causes major problems.
Yes. And so when you're doing something like that, you would want to take a break. Like if you're binging on spring break or whatever, you kind of want to take a break from that and let your body heal and recover. The difference is what we're doing is optimizing. That's just the best word for it. So we're staying in these acceptable ranges. We're monitoring you as a whole, not just this one thing. And we have this sort of ongoing monitoring. So it's safe to do. You're being monitored. And that's just a big thing to me, because recently we get a lot of people with these programs. There are a lot of programs out there now that are like, oh, hey, and they'll throw many, many people on testosterone. I think it's great. I think many people need testosterone supplementation, but I think that ongoing monitoring is really the key. And we get a lot of people coming back to us from those. And they just are like, I didn't feel comfortable. I didn't feel like they knew who I was, and they were monitoring all these different aspects. It was really just very cookie cutter. Everybody's on like 1 cc of testosterone. You never talk or see anyone. So That's the other piece to doing it long term, is having people invested in you and monitoring and adjusting it as you go through time.
That's really great. And I want to touch on one more topic, because you did a great job of not going too deep, but still showing, hey man, there's science behind this. There's all this like incredible job.
We could talk forever.
Forever. And so the one thing that I want to kind of finish with is what we've talked about. These hormones, they're kind of the baseline profiles, because they are generals of so many other things, right? And so many body functions. There's also things that change the body structurally or help it that we do specifically, that I want you to talk about, that would be more advanced stuff that we wouldn't even look at until we got the hormones balanced. So when we're looking at things like peptides, those kinds of deals, would you just explain what, let's call it second level performance stuff is? And again, this is all still within range and normal ranges, but once the hormones get balanced, sometimes there's still room on our potential ceiling that we talked about earlier, or there's a special need for these peptides. And we do IVs as well, but those are more general wellness and that kind of thing. So these specific performance enhancers, peptides, stuff like that. Can you just speak to that for a few moments?
Yeah. So peptides are, it's a very general term, like a medication many people are familiar with, insulin. Those are peptides technically in terms of their chemical makeup, but peptides, the way we're referring to it, is basically a treatment to sort of boost your body's natural growth hormone production. It's just another hormone that we found associated with aging and all of the signs and symptoms that occur with that. And, without going too deep, one thing I explain is most people know that like HGH, or human growth hormone, is performance enhancer. It's banned. And if you think about it, it's because it can enhance your performance. It can do things that give you a competitive advantage over other people. And so those good things are helpful for people who are dealing with, again, aging and their bodies being exposed to everything that we're exposed to now. So like building up lean muscle mass, helping shift that fat deposition that changes with time, again, with the midline and the fat that we store inside of our abdominal cavities, which, by the way, we call that visceral fat. There's a rating for it on our in-body, so it kind of distinguishes fat in the subcutaneous tissue, just arms, legs, stuff that we don't like the way it looks, and then the stuff that's in our abdominal cavities causing inflammation and organ dysfunction, kind of two different things, but it helps with that.
Yeah, so to be able to measure, that's a really cool thing to see that.
I love having that rating on there. But then, peptide is basically just a way to kind of wake our bodies up and say, hey, we would still like you to make and release growth hormone, please, while we sleep. So it's so cool that there's such a vast array of peptides that are being developed. And we like to use this. We use a select few, and we've been using them for a while. We don't jump into all of like the newest, brand new, we don't want to be first in always to those. We like to stay with the tried and true options that are giving our patients really great results, and they come back loving them. And again, they don't have that whole thermostat effect and kind of negative feedback thing going on. And so sometimes people are looking for, if they're hesitant about doing a hormone long term, peptides might be a great option, because you're really not impacting at all any kind of your production in any negative way. You're just boosting it. So.
Yeah. So lastly, I mentioned IVs a moment ago, but some people might be like, wait, why would you get an IV unless you were in the hospital? I've seen it on TV, right? On the emergency room shows where there's an IV bag dripping in. We don't look at it that way. We use IVs as a form of, as a health tool or health aid. Can you just describe IVs and how they work and what they do?
Oh yeah. So we're going to talk about the whole ideal world thing again. So It's like, if you can drink water, you should be hydrating that way, just drinking your fluids. Totally. We're so on board with that. Absolutely. But number one, people aren't great at that. So occasionally a little hydration boost is really great for health, and also, how you look, your skin, and if you're looking for weight loss, you've got to be hydrated. So lots of reasons to be sure of that. And then on top of that, in an ideal world, our diet is perfect and the nutrients in our food are optimal, and we absorb every little bit of that, but that's just Again, not the case. So yes, we would advise a great balanced whole food, lots of plants eating pattern, but most of us have some sort of chink in our armor in one of those places. We're either not great at doing that, or the food source is not optimal, or we're not absorbing it all. We have some sort of gut issue. So then IV supplementation is awesome. You're really driving in the nutrients at high doses straight into the bloodstream, drive them into the cells, get a nice boost of vitamins and minerals that you need.
How often should people do that if they wanted to do IVs to make sure they were running their vitamin levels at optimum range? Is that something that you do every month, every week? Just depends?
I would say, like, in general, maintenance is a once a month thing, but that's a super individualized question. There's, IV protocols for people where they're doing an IV like every day for more specific things like functional medicine, real specific things that they're attempting to achieve. I would say for us, every 2 to 4 weeks is great at keeping those levels up, boosting them in between your multivitamin and your regular daily routine. So
that's wonderful. Jess, you have been such a wisdom giver in this show. I hope people that are listening, if they've been doing HRT, which is hormone replacement therapy, or IVs, that this gave them a little bit more fundamental knowledge for their game so that they understand what they're doing.
And keep telling your friends, because that's where they come from.
Yes.
People like you who are doing it or on it, and they're like, oh, thank goodness my friend told me. They were like, I felt like you. Go check that out.
Yes, absolutely. So those people are gained, but if someone had never heard the topic, you did a really nice job of explaining what it's all about. So if people have further questions, they want to get a hold of you, they want to check it out or look at blood work or say, hey, where am I at in this process? How would they get a hold of you to learn more?
We have several ways now, very connected. Our main phone number is 720-295-1229, and all the staff is amazing, excellent. They are highly educated and can connect you. They can either answer your questions or connect you with me or someone who can. So the phone number is great. You can also email me. So Jessica, Jessica at FitMDUSA.com. That comes straight to me. Happy to answer any questions. And we can even set up just a consultation. We do phone consultations. We can do video calls if you prefer that. You can email me initially and we'll kind of set you up with what you need. So
that sounds great. Well, Jess, thank you for taking time away from your schedule. I know you're packed today and you just were a rock star to break it away and come in. So thank you. Appreciate what you do for our patients. Appreciate what you do for me to help me feel optimized and live optimized, and can't wait to see you again.
Awesome. Thanks for having me.